Hi, class. Welcome. It's Dr. Linder. Let's take a look at the bone's role in calcium homeostasis. So, the bones store about 99% of the body's calcium, and the parathyroid gland secretes PTH or parathyroid hormone when serum calcium levels drop. Osteoclasts are stimulated to increase bone reabsorption, and what happens is calcium levels will go up. So that's the function of PTH, is to increase serum calcium levels. PTH also stimulates the production of calcitriol by the kidneys to increase calcium absorption in the intestines. So I'll show you how PTH and calcitonin work together in two separate illustrations. The skeleton is the reservoir for calcium and phosphates. What is the importance, especially of calcium? Calcium is so integral. It plays an important role in nerve firing, in muscle function, in the ability to clot, in blood clotting. And it's an enzyme. It's an enzyme function. It actually is like a cofactor that can stimulate many different biochemical reactions. So it's involved in enzymes working. It ends up being a very important cofactor. But the body's ability to keep it in a very, very tight range, like 9 to 11, is so integral because too much of it can cause cardiac arrest and too little of it can cause respiratory arrest. So the body uses calcitonin by the C cells of the thyroid gland and the parathyroid hormone from the parathyroid gland. And it uses the bones, the digestive tract, and the kidneys to either increase or decrease the amount of calcium. It uses the bones because that's where calcium is stored. It uses the digestive tract because that's where calcium is absorbed. And it uses the kidneys because that's where it can be excreted or preserved. So let's look at what happens if there is low calcium levels in the plasma. All right. So the main goal is we're trying to increase blood calcium. But right now we have too little. So the end result, we want to go from too little to increasing the level. How do we do that? Well, this is where the parathyroid gland comes into play by pushing out parathyroid hormone. What that does is it stimulates the osteoclast to break down bone, and that's going to increase calcium in the blood. It's going to increase the intestinal response, the rate of absorption. That too will increase calcium. And the kidneys, what the kidneys do is they produce vitamin D, which is needed by the intestinal tract to help increase the absorption of calcium. But the kidneys, besides producing vitamin D, say, hey, we don't want to lose calcium in the urine, so let's conserve it. So it decreases calcium loss. So bones, intestines, and kidney. Now here we have high calcium, and the goal is we want to try and lower it. So how do we decrease blood calcium? This is where the thyroid gland comes into play by the C cells producing calcitonin. It blocks or inhibits the osteoclast from breaking down bone and only allows the osteoblast to build it. So that's how we can decrease calcium. What does it do to the intestinal rate? It decreases the absorption. So if you're not absorbing calcium from your food, you're going to decrease it. And what happens at the kidneys? It says, hey, let's excrete some of the calcium. So if you're increasing the loss of calcium at the kidney, well, now that's another way of decreasing calcium. And it decreases vitamin D production. Decreases vitamin D production. Okay. So, make sure you feel comfortable with knowing what they do. So PTH is produced by the parathyroid gland in the neck. It increases the calcium ions, and we went through how that works, what it does by stimulating osteoclast, increasing the intestinal absorption, and decreasing the calcium excretion. But calcitonin, we're trying to decrease the amount of calcium, so the C cells produce it. It decreases the calcium by blocking osteoclasts and increasing osteoblasts. And it increases calcium excretion at the kidneys. Okay, so very important to review those two concepts. When we look at the composition of bone, look, well, about 33% is protein, it's collagen. Then you got 39%, that's calcium, 17% phosphate. You got potassium, sodium, magnesium, carbonate, you got these others. Okay? So that's a pretty important visual aid here. This shows why we need protein in our diet, why we need vitamin D to absorb calcium, why you have to be careful with alcohol, diuretics, coffee. All of these help you lose water. And when you lose water, you lose minerals, especially potassium and magnesium. When you lose potassium, you're going to lose magnesium, and then you start losing all these other minerals. They fall in place. You also want to watch blood sugar. High blood sugar means you're going to urinate more. You urinate, you lose water, you lose minerals. You need good protein, good digestive enzymes, good pH. Very important.